they want to start over, this is the chance to do that. This is maybe the best feeling they ever had in my life by this program.
For years I was miserable and I thought that was normal. Now I'm enjoying life, I'm doing things, I'm going places alone or with my wife. I don't have to be surrounded by people. I'm not always trying to impress other people. You know, I'm happy with me.
I was scared to go out, basically. I just wanted to be in my house, be alone. And then after treatment, I have a better relationship with my son. Me and my sister can talk on the phone. I go to their house now. Like I said, I go to concerts and things like that. So treatment has really helped me and basically given me my life back.
Trust yourself that you can make that change and commit to it, because your life can be great again. You can find purpose.
It caused me a lot of problems, and I did not know what was wrong with me at the time. So I did that for almost 17 years. About every 5 or 7 years, I'd be looking for another job.
It was like a scratch record. You know, whenever certain things happen, you just go back to the same feelings, the same atmosphere, the same type of paranoia every time.
I was noticing, and other people were noticing, that my hypervigilance was coming out at times that were not appropriate for someone who's working. And I was snapping at people, just very irritable. Didn't really understand that it was related to PTSD, but it was interfering with my ability to work.
I was scared. You know, I was very scared. But I knew if I didn't do anything, the next thing was going to be either jail or death.
Going into it, I was nervous, just like anyone else, and hesitant. I thought, they're not going to know how it feels. They're not going to understand my feelings, or really, I'm not going to be able to connect with them. What if I have a therapist who that chemistry just isn't there and I can't open up?
Felt very vulnerable. I was scared. I'd never been scared before. Not like that. Thank God I did it.
I felt I was alone. After being through my traumas, nobody could understand, but I was wrong. And after CPT, I learned that there's other people that's been through the same problems or similar, and they can understand.
Cognitive processing therapy, or CPT, is an evidence-based treatment for post-traumatic stress disorder. CPT is trauma-focused, which means you can get better sooner and you don't have to wait to feel better. CPT is something that works for a wide range of individuals, so if you're suffering from depression, substance use, or have a history of traumatic brain injury, in addition to your PTSD, it can still work for you.
CPT is not a therapy that the therapist does to you. It's an active treatment with written assignments where you practice the skills and then you can apply them moving forward in your life.
While we cannot take away the memory of the traumatic events, through CPT, you can learn skills that allow you to move beyond the pain and take control of the memory for the rest of your life. CPT is an effective recovery-focused treatment for PTSD. It's typically offered in 10 to 15 weekly or twice-a-week sessions. And the nice thing about CPT is that you'll find afterwards that there are changes in how you think about yourself, others, and even the world.
CPT has three main goals. The first goal is to reflect. We want to help you understand PTSD and to examine the impact of your trauma on your thoughts and feelings, and to decrease avoidance and emotional numbing. The second goal is to redefine. We want to help you learn to evaluate your thinking and to consider alternate viewpoints of the trauma, yourself, and the world. The third goal is to recover. We want to help you reduce your distress related to memories of the trauma, to reduce feelings of anxiety, anger, guilt, and shame, and to most importantly, improve daily living.
CPT is a cognitive therapy that allows you to examine and challenge your thoughts about the trauma and the world itself. So CPT has 3 stages or phases that you go through as part of the process. The first part, we focus on becoming aware of your thoughts and feelings. One important thing you learn is how to recognize what we call stuck points. These are common thoughts people develop in response to PTSD that stop them from recovering. Common stuck points are thoughts like, the trauma was my fault, I can't trust anyone, the world is unsafe, or I am worthless. In the second part of CPT, we focus on learning skills to help you question or challenge your thoughts. And in the third part, we work on understanding changes in a wide range of beliefs, both about the trauma itself and about wider views of oneself and the world. At this point in therapy, individuals report having greater control over the trauma instead of the trauma controlling them, and they are able to begin to move forward with their lives. Individual CPT can be delivered in 2 formats, CPT and CPT plus trauma account. In both versions of CPT, you're going to identify your thoughts about the trauma and see where you become stuck in your recovery. But in CPT plus account, you're also going to write your traumatic events. The choice is up to you. CPT can also be conducted in a group format. CPT in group offers the opportunity for support and recognition that you're not going through this alone. Typically, there are 12 90-minute sessions once or twice a week. And remember, the details of your trauma will not be discussed in group.
There are a number of studies that support the use of CPT with a wide range of traumas, including physical and sexual assault, childhood traumas, motor vehicle accidents, natural disasters, combat, as well as those who have experienced multiple traumas. Across ages and gender, a large majority of those treated with CPT show a great deal of recovery.
We have found that the patients who are committed to the treatment process and are informed about what is expected of them through the therapy have the best outcomes.
A collaborative relationship is central to CPT. The therapist creates a safe environment where you can look at your thoughts in a non-judgmental way.
This person is not judgmental. They are not there to look at you any different. They're there to listen to you. All you're doing is you're creating a relationship with someone that can be your earpiece.
One thing that they did mainly was to challenge me. You know, they always made me see things in a light where I can understand them. They broke everything down for me. They helped me understand what I was looking at and thinking about. You know.
She validated my feelings, but then through CPT, she challenged me to challenge the origins of my beliefs, the impact that it was having on me, and to think about, was it some other way I could have perceived the situation?
CPT is different from other treatments. It's an active treatment where we use worksheets to examine your thinking and challenge your stuck points.
When doing the assignments, you actually see something that you didn't realize. you start figuring out stuff that you didn't realize that you were holding on to.
Doing CPT, the sheets it's become automatic now. You're doing them in your head.
Honestly, the understanding that comes from it is mind-blowing. You can't replace that. Once you break it down, it makes sense and you can start your healing process.
While we cannot take away the memory of the traumatic events, through CPT, you can learn skills that allow you to move beyond the pain and take control of the memory for the rest of your life.
CPT helped me to really break down daily activities, and I still do it today. Situations I get into and I stop for a second and I think before I react.
Now I confront the problems. Now I look at the problems face on or head on and say, what's causing this? You're not gonna get me. I got you. I'm gonna beat you.
Now, when a stressful situation presents itself, I can take a pause and think about whether or not I'm seeing the situation accurately.
Well, my life is different with CPT because it's more calm. It's just more peace with people and myself.
It was very hard for me to write about it and talk about it, but the program forced me to do so. And by doing so, it helped me get that monkey off my back. And it made me feel better over time. I'm saying I could see light at the end of the tunnel and it wasn't a train coming.
Since therapy, I started going to concerts. I went to my son's basketball game. I was able to go to those and he was so excited. So my son went from leaving every weekend, going somewhere, to actually wanting to spend time with me. We watched movies together, do things together, and we took our first vacation this summer. And he loved it.
After going through CPT, it's sort of like you hit the jackpot, but without money.
For me, the best part of CPT is that people often think that their life is over. They've lost their friendships, they've lost their family, their social connections. But when they go through the process of the therapy, they make new friends, they rediscover those old family connections, and they're able to build a new life where once they thought life was over.
What do you have to lose? Should I go in and seek treatment? Yes. If you're questioning yourself and you're questioning, do you need it? You probably do.
CPT therapy has just been amazing. It's truly changed my life.